catheter care. The role of the resident will be played by a mannequin. The mannequin does have in place an indwelling catheter. You are asked to provide cleansing of the perineal area as well as catheter from the meatus 4 inches down the catheter itself. You are asked to leave the resident on a dry surface, which is just their bed, right? This is the way this skill will present itself. Hello, my name is Myra. I'll be your nursing assistant. I'm gonna go to your bathroom and wash my hands. And your name is? Miss Jones, nice to meet you. May I check your name, ma'am? All right, Miss Jones, today I'm going to provide you with catheter care. Is that okay? Okay, great. I'm going to give you some privacy. I'm going to gather the supplies. So for these supplies, I will gather, again, as in most procedures, 2 barriers, a clean and a dirty, as well as a pad to place under Miss Jones to ensure we do not wet the bottom sheet during cleansing. I need 4 washcloths, a drying towel, and a bath blanket. Hold these items, again, away from my body. Miss Jones, is it okay if I place the bath blanket at the foot of your bed? Thank you. I would then place my barrier down for my clean items, as well as place my dirty barrier on this side chair. Miss Jones, I'm going to go into your side table and gather some supplies. I'm going to gather the bath basin and the soap. I will need a pair of gloves, so choose the appropriate size for you. And I'm going to gather the water, Miss Jones. I'll be right back. I'll make sure this bath basin is halfway full of water. I'll bring it back. Miss Jones, would you like to check the temperature of this water? Is that okay for you? Good. I will bring this closer. Place this down and raise the height of the bed. Now again, the height of the bed is subjective. It is to reduce strain on your back, so you raise it whenever you're ready. Prior to starting this skill, however. Now before I start or place the bath blanket on, I'm going to put on my gloves for infection control purposes. I do not want to have contact with that catheter mistakenly. All right. I'm going to now place the bath blanket on my resident. And I'm going to pull down your top sheet and pull up your gown. I'm going to take a look at your catheter, Miss Jones. I'm going to make sure that it is above the leg, free flowing, not pinched, below the bladder, and not touching the floor. You must say that at least once during the course of this skill. I will remind you towards the end. Miss Jones, I need to place a pad behind you, so I'm gonna have you come towards me on 3. 1, 2, 3. Good, and I'm gonna have you turn away from me. 1, 2, 3. Good job. Cover her for privacy and place the pad underneath her. All right, Miss Jones, on 3, back onto your back. 1, 2, 3. Good job. And we'll extend this side. All right, expose the perineal area. And just as in peri care, we're gonna ensure that our dominant hand is facing the foot of the bed. So if you're right-handed, this would be the appropriate side. If you're left-handed, you should be on the left side of the bed. So with my non-dominant hand, what I'll do is I'll have to hold the catheter. With my dominant hand, I'll be cleansing the perineal area. So that's why your dominant hand should be facing the foot of the bed. Now what I'll do is I'll get my first cloth ready. Make my mitt. Get some soap all around that cloth. Hold the catheter itself just with the tips of your finger, and then we'll cleanse the perineal area. So palm down, front to back, palm up, front to back. Again, pointer, like we do in Pericare, and pinky. Cover, dump. Now we're going to rinse, same technique. No soap for this one. Hold with the tips of your finger, the catheter, so we ensure not to pull on it. So again, front to back, palm down, front to back, palm up, pointer side of the cloth for the inner labia, pinky side of the cloth for the inner labia. Dump, and we're going to dry. Again, front to back, pat. Different part of that towel, front to back, pat. Different part of that towel, inner labia, front to back. Different part, inner labia, front to back. All right, now we're gonna clean the catheter itself. We need to remind the evaluator and the resident that the water is not cold, soapy, or dirty, so we're gonna continue to utilize it. Prior to turning you over, Ms. Jones, I'm just gonna make sure that this pad is in and prepared for removal. All right. So we'll get our cloth ready. Soap both sides. We'll expose the catheter. We'll hold it like we did to clean the peri area, but now we have to utilize this cloth, and we'll utilize the top of our hand to clean 4 inches down, the palm, the pointer, and the pinky, utilizing different parts of the cloth with every wipe. So now we're going to rinse the same way. The top of our hand, the palm, pointer, and pinky. We'll dry. When we dry, we cannot milk or pull on the catheter. We can only tap. So this may seem weird, but this is all you can do. Tap. Tap. Different part of that towel. Tap. And tap. All right. Miss Jones, we're done. We're gonna have you get off this pad on 3. You're gonna get onto your side because we've already pushed it in. 1, 2, 3. Alrighty. Cover you for privacy. Now remove the pad. You will not need another one. She is not incontinent. She has a Foley in. So back onto your back, Miss Jones. 1, 2, 3. Good job. We're gonna take this bath blanket off. Miss Jones, are you okay while I go dump the water? All right. So I'm going to go to the sink. I'm going to dump the water into the commode. So dump, turn on the water, turn it off, dump into the commode, barrier or paper towel, dry it out, and one more paper towel as a barrier to open the drawer. So same paper towel, open the first drawer, place this item in, close it, place that barrier there, then you can remove your items. Miss Jones, are you okay till I get back? All right. So gather this away from your body, separate garbage and linen. Remove your gloves. Evaluator, I'm washing my hands. Miss Jones, are you comfortable? Do you need anything before I go? All right, here's your call bell. If you need something, give me a ring. If not, I'll see you in about 2 hours. I'm gonna lower your bed. Would you like your curtain opened? All right, I'll leave it closed. Evaluator, I didn't see anything on the skin. No complaints of discomfort or pain. Wash my hands and I'm done.